Good evening and welcome. My name is Malik Bush, and today I will be discussing the healthcare worker shortage and its impact on our community. I would like to start by opening up with a quote by Winston Churchill. He once said, "Healthy citizens are the greatest asset any country can have." In other words, healthy citizens make for a healthy society. And by that same notion, health should be provided to everyone. However, the chronic shortage of healthcare workers is one of the main obstacles jeopardizing the access to care in the community. According to the World Health Organization, the serious shortage of health workers across the world has been identified as one of the most critical constraints to the achievement of health and development goals. The federal government has labeled this a national crisis. So, what is health? According to the World Health Organization, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. If I were asked to define health, I would say health to have health is to have life, and to be full of health is to be full of life. Health is a fundamental right that should be provided to all. And who provides this care? Healthcare workers. A healthcare worker is anyone who delivers care and services to the sick. For example, these are your transporters, your surgeons, your nurses. They're even your dietitians that you see in the cab. They're your laboratory technicians, and even your medical waste handlers. So, why is there a shortage? There are two main causes for the shortage of healthcare workers. The first being the aging U.S. population. We've all heard of the term baby boomers. Baby boomers are individuals born between the years 1946 and 1964. By the year 2030, 1 in 5 Americans will be a senior citizen. We know with age comes chronic diseases. These baby boomers will start to require more specialized care. This generation actually visits their physicians 2 times as many as those individuals up under the age of 65. According to the U.S. Census, about 10,000 baby boomers will cross the threshold of 65 daily up until the year 2030. This increase in our senior citizen population results in an increase in patients at the hospital. Sorry. Also, this increase in our senior citizen population results in an increase in retirement. The increase in the demand for workers and the decrease in the supply of workers results in the shortage that we see today. Another reason for our shortage is the huge toll the infectious disease known as the coronavirus has taken on the healthcare system. Nearly 1 in 5 healthcare workers have quit their jobs during the pandemic, according to a survey done by the Morning Consult. It also states that 18% have quit and 12% have lost their jobs, resulting in a 30% loss in the labor of the healthcare system. This is all a result of burnout. I, I experienced what burnout does on a family firsthand because my mom is a nurse. She's actually the reason why I'm doing this PowerPoint presentation because in the beginning of this class, I didn't know what to do for my topic. Something told me to call my mom, and so I did. And she was like, please educate them on the shortage of healthcare workers. And so here I am. So shout out to my mom. Also, do you have a family member that's a healthcare professional? Have you experienced firsthand the toll that it has taken on them? Also, what happens when you go to the hospital? Now you're experiencing high insurance premiums, high deductibles, and high copays as a result of this shortage. You're also having to wait in the lobby for hours and hours before you can see your physician because the rooms are being filled by previously stated elderly people and coronavirus patients. So, what can we do to increase the healthcare workers? Education is key. We must launch advocacy campaigns to advocate for our healthcare workers. This advocation will inform policymakers to change legislation, which I will talk about more in my next presentation. We must prioritize the health of our healthcare workers. Thank you. These are my references.